We're all here.
Yes.
Good.
What's happening, ladies? What's happening, ladies? How are you?
Happy Wednesday.
Happy
Happy,
Wednesday.
happy
We have our
Wellness.
pearls on. Look at us. Look at us,
Yes.
our pink and pearls.
And guess what I'm wearing? Guess what I'm wearing?
Yes.
Guess what
Pink
I'm
power. Real
wearing?
men wear pink.
Real
They-
men wear pink, and it looks good on you.
Think about where.
That's
Yeah.
what they say,
I'm-
right? So I guess I must be a real man now, right?
Yes, that's what they say.
You're a real
I'm-
man. You were a real man before, but now you're a real man.
Hmm.
No words for that one, right?
You know, I would have felt really bad if I showed up not wearing pink. I got to tell you.
Well,
Well, I feel bad because I'm not wearing pink. I just,
well, you have on white for hope, so that's what we're going to do. So you have on our pearl whites, and we're bringing him the pink.
it's a little bit, it's a light green, so it's green for life.
Okay. Oh, okay.
Life.
So life. And that's what Breast Cancer Awareness Month is all about, how to encourage
We'll do it that
women to
way.
get information and men so they can live a vibrant and life with and beyond cancer.
You know, so one thing that I learned, and you know, life is so strange, guys, because as you're having discussion with people, you're talking to people, right? And when you stop and really stop to smell the roses or the flowers for a second,
Oh, yes.
you get there are things that you hear that you don't normally hear with all the noise. And the one salient point that was made last week was a lot of the health issues and conditions that we are, you know, struggling with really all stems from the lifestyle we choose to live. You know, all my life, I've never really stopped to really think in terms of how the human cell works, and what you consume and what you put in your system are you know, kind of the agents that help damage these cells and
Yes.
create all these other complications that we have. And I'm like, if people really just stop for 1 second and ask themselves, the life we choose to live and how we're living it,
Mhm.
how is that overall impacting our physical, mental, psychological, you know, health condition, and understand that we're reckoning with this, because it all really starts with really the life that we choose to live, the lifestyle.
Yes.
That's so true, Anthony, and our clinical experts on this co-host panel would back me up on dittoing that and echoing it and checking it off as absolute truth. But you know, we live in an industrial society, so we have a lot of environmental impacts. We have food that looks healthy, but actually is genetically modified. So we have to think around our nutrition as medicine for our body and really get to understand it. I'm going through a whole new orientation, even at this age and stage of my life, around how to use food in particular to heal and make me feel better. So I'm a new convert to something like sea moss. I cannot say that I'm running down the track to eat my sea moss because it is an acquired taste.
To say the least.
To say the least, which is why Yvette looks so great, because she obviously knew about sea moss. This is a new learning for me. These types of nutrient dense and enriched foods that we should be eating normally that is not necessarily normally. Hey, Dr. Brian Williams.
And I start my day with hot water with lemon, turmeric, and cayenne pepper. I have that drink every morning as soon as my feet hit the floor, and that gets my metabolism going.
So I have a question about that. Before, I know, Anthony, you've got to introduce the program, but since we hop right into it, I'm doing coffee and lemon for the same reasons, to do a really wonderful boost my metabolism, do a great alkaline reset from the night, and give my organs a jump start before I start loading them up with calories and other factors. So I go back between those two, the same concoction, because I love anything hot. So hot drink is wonderful for me. But I also love coffee, so I found this opportunity to mix the lemon and the coffee. Any thoughts around that? Anyone? Does that sound foreign?
Well, it doesn't sound foreign, but you do have that
I
caffeine
can help you.
element.
I start my morning with coffee.
Dr. Christensen, what did you say? I know I got.
So I said I can't add to that. I just start my morning with coffee and juice and maybe cereal, fruit. But while lifestyle is a real important part of what affects your health one way or the other, it's a part. And the environmental issues that you mentioned are really important as well. And there's some genetic issues, of course, involved with breast cancer. But all of it working together but lifestyle is a critical part. What we eat, how we exercise, where we go, what we do, our mindset, everything.
Yeah, and I bring that up. Oh, by the way, thank you, Byron Williams, for wearing your pink as well. So welcome to the club. Okay, brothers in unity, wearing pink together, celebrating breast cancer awareness. So we're doing our part. Thank you so much, Dr. Byron Williams, for that. So, and the reason I say this, right? Oh, by the way, folks, this is a little bit of housekeeping. You are listening to the live broadcast of the Marketplace Show Reset, segment number 1 on health, wellness, and lifestyle. And I have an incredible panel of experts in their respective field as it relates to health. We have a medical doctor, former policy person, served in Congress. We have a healthcare admin person dealing with the administration of health. And then we have a practicing nurse, a clinician nurse as well. So you have, if you will, you have that trifecta, right? Where you have the business of healthcare, you have the medical part of practicing as a medical doctor, which Donna have done for many years, and obviously in her role in policy, working in Congress as a former congressperson, and then of course Yvette as a nurse clinician, and also working closely with farmers in the pharmaceutical industry. And so this is one of our really important segments, because without your health, you have nothing. I saw a discussion over the weekend, and it was in this order. Somebody, a very wealthy person, launched a new show, and it said health, wealth, and what was the third one? I'm having this team. Sorry.
Health, wealth, and wise?
Wisdom.
Wisdom.
Yeah, there you go. Wise, wisdom, wise. Exactly. Those are the chronicle order in terms of how they say one should live their life as they look at how they pursue their lives. So health first. If you don't take care of your health, nothing else matters, right? And obviously, if you're going to create wealth, you create wealth with the understanding that wealth is not just simply defined by material things, the vanity part of things. Wealth, you can have a wealth of knowledge, wealth of relationship, wealth of just a lot of things, right? And of course, there's the monetary aspect of it. And then the wisdom, the life lessons that you learn throughout your years gives you wisdom. And so those are the kind of things that I believe are the foundation for why we do what we do week in and week out. And this segment is dedicated towards making sure we educate not only ourselves, but our viewers, our listeners, in regards to that. So thank you, ladies, for that. And so what I'm going to do is, I know we have a guest, and I'm going to step off because I got to make sure you, the expert, have that conversation, and I'll be behind producing both. So ladies, I want to thank you for that, and have a great show.
Thank you.
Thank you, Anthony.
You know, one of the things that we left off with last week was a discussion around those environmental issues. And we wanted to touch on some of the more genetic issues. Dr. Christensen, you brought that up, that there is some genetic predisposition towards the gene mutation that leads to breast cancer, and gene mutation that leads to other cancers throughout the body. But in terms of talking about it, you know, I wonder if our audience is familiar with the term, and I certainly was not. And not until I realized I needed to have this test because of this mutation that runs in my family. And that was the BRCA, BRCA. That is the
Right.
susceptibility gene, BRCA number 1 and BRCA number 2. You know, it scared me thinking that I needed to have this test because both grandmothers, maternal and paternal, had breast cancer. So my obvious genetic risk is elevated, and I'm pleased to say that I had a very good report. The number was within the range of not a risk, which is reassuring to me. But people who inherit this mutation in the genes are at risk for developing breast cancer and ovarian cancer, but compared to the general population. What can we share with our listeners and audience about this test and the importance of actually consulting with your healthcare provider on whether or not you should go forward with a BRCA test?
Oh, absolutely. Definitely, you have to get tested for your BRCA, even if you are not aware that anyone in your family has ever had breast cancer. And I really kind of wanted our guests to break down these different aspects of that for everyone. As far as getting their BRCA test, I had mine done because breast cancer runs in my family as well. And then I like to kind of go into the different types of cancer because it's not just one breast cancer. People think you say, oh, she's got breast cancer, and a lot of people don't think past breast cancer, but then they'll wonder, well, why does this person was able to get treatment and do well, and another person got treatment and they didn't do so well? Because they're not familiar with, you know, HER2 positive, HER2 negative breast cancers, you know, PR positive, you know, hormonal, different types of breast cancer. And so I think it's good, just a glimpse. I don't want to get too deep in it for them, but I do want them to know, you know, the different types of cancer. And then when the cancer leaves the breast, it's still breast cancer. A lot of people don't understand that when the cancer metastasizes from the breast to the lungs, it's still breast cancer. It's just in the lungs.
That's fascinating. So just before we're so happy to have as a part 2 repeat, and we welcome you back, Deanna Weaver, our RN and health consultant du jour. We had such a good time with you. We needed to bring you back. We have many who need to come back, but this is such a critical topic, and I agree. And already that's a piece of education for our listeners and our audience that there are actually different types of breast cancers because we do generalize it and proceed forward. So, Deanna, welcome.
Thank you. Thank you. So breast cancer is definitely like such a big thing that needs to be tackled and talked about. You guys mentioned about that BRCA mutation. And so basically what it is that within the immune system, there are cells and their job is to spot out abnormal cells and kill them basically. And so that's why for a lot of people who may potentially develop cancer, their immune system wipes it out before it evolves into cancer. And so what's going on with that BRCA mutation is that the BRCA cell is one of those cells that are meant to wipe out those abnormal cells. And so if there's a mutation of that BRCA gene, then it's not able to function correctly. So it doesn't recognize those cancerous cells and wipe them out the way they're supposed to.
Interesting.
And so one thing that a lot of people don't realize is that everybody thinks about on my mom's side. On my mom's side, my mom had cancer or my aunt had cancer on my mom's side. But it can absolutely come from the father's side as well. So you really have to look at both sides of your family tree. And as Yvette mentioned, definitely just really paying attention whether you have a family history of it or not. Just really being mindful of, doing those breast exams, possibly getting that blood work to see if you do have that mutation. Now, just because you have the mutation doesn't necessarily mean that you are going to develop cancer. It just means your risk is greatly increased to develop cancer.
Dina, I have
Yes.
a question.
Yes.
So, kind of going into lifestyle, we have these celebrities like Angelina Jolie who chose to have a double mastectomy because of the risk of her developing breast cancer. Would that be considered normal prevention or an extreme prevention?
So I feel like
Mhm.
at one point it was considered to be like just like crazy out there. But a lot of women are really starting to go that route, especially if there's like a strong genetic, like if they have moms that had breast cancer, aunts that had breast cancer, sisters that had breast cancer, like that it's really, really bad in their family. A lot of women do decide to go that route, just, so that they're able to wipe it out before it even can become a thing, basically.
Okay, thank you.
Because they actually would have a chance of developing it in the other breast just as they developed it in the first breast. And one of my colleagues, and I can talk about it because she's been very open, Debbie Wasserman Schultz, did the same. She found her breast cancer very early, but she still decided to just do a double mastectomy. Because the chances, and then I have someone who worked for me who did not do a double mastectomy. She did one breast and later on had developed cancer in the other breast and had to go back and have the second mastectomy. So you really need to consult with your physician, but and have a determination as to how high your actual risk is, as Deanna said.
Yes, because there's sorry, go
No,
ahead.
go ahead, Deanna.
I was just going to say there's other, there's, as Dr. Christensen mentioned, there's kind of a big picture that you have to take into consideration, because genetics is only one component to your risk for breast cancer. Other things that can increase your risk would be if you started your period before like the age of 12, or if you start menopause after like the age of 55. So basically those hormones that are changing as you're every month when you're menstruating, the longer your body is exposed to those changes, the more your risk is increased. So factoring in the age of onset of menarche, or when they started their period, when, if you've already hit menopause, what age, are you obese? All of these things can play a factor into developing breast cancer.
That's very, very fascinating that we have to look at the origins from a hormonal standpoint, and not just genetic or environmental, that there is something there that we have to better understand and really keep that long health history. So it brings to mind that if you have daughters or of young women, that they begin really paying attention to their health history, beginning to record that. That's very fascinating because a lot of women forget along the way. Is that the same condition if you were to have a hysterectomy and you had your ovaries removed, and so then you automatically go into menopause, or you have a delayed reaction because you have maintained your ovaries? What's the impact, if any, in those particular scenarios?
So if you have like a total hysterectomy where they're taking your uterus, your ovaries, your tubes and everything, it depends on the age. The younger you experience it, typically, the better off you are as far as breast cancer risk. One thing that they do with some hysterectomies is even if it's only your uterus that they're removing, they'll also remove your fallopian tubes, because if they leave your ovaries and your fallopian tubes, that can potentially increase your risk for breast cancer. Also, if you do have everything removed and then they decide to do hormone replacement therapy, well, hormone replacement therapy over extended periods of time can increase your risk as well.
So it's interesting because when we talk about the association, and I'm interested in that because I feel like I'm kind of like right in that alley lane right at the moment, is instead of having hormone replacement therapy, being able to look at my nutrition, my exercise, my sleep patterns, what kind of beverages, trying to go the holistic natural route versus conventional medicine-based route, so that I use the thing in nature to really support my experience in menopause. And so far, so good.
That's awesome. Yeah, definitely. And there are some, when it comes to treating some of the symptoms of menopause, there are other medications that they can give you that will treat some aspects of it. So you don't necessarily have to do hormone replacement. It really is just kind of a case by case basis. And as Dr. Christensen mentioned, just really working with your physician on what's the best situation for you.
Well, we got away from that question that you asked, Yvette, at the top of the show, and the different types of breast cancers.
Breast cancer. Yeah, I was just going to comment real quick when she was talking about the different types of medications they're using now for hormone replacements. And one of them are antidepressants, which I do not recommend. I had the worst experience with that. I just decided, as my grandmother would say, suffer it to be so, rather than take any medications when I was going through, because it was, them antidepressants were very hard. And my body went through a real huge withdrawal, trying to get that out of my system. And I had to take a holistic approach, as you said, Linda, using omega-3 fatty acids and vitamin D and vitamin C. I had to really cleanse myself from all traces of that medication, just to avoid taking estrogen. And I thought, well, maybe estrogen should have been the better choice. If I had known, I would have had to go through all of that with the antidepressant for estrogen replacement. But getting back to my question, so, Dina, I was reading this morning, actually had to speak today with a group of nurses, and we were talking about a new drug for HER2 negative metastatic breast cancer. And so I'm not sure if people realize, that there is a breast cancer, that estrogen feeds. There's a breast cancer that you could have the progesterone, you can have the epidural, growth hormone cancers. And I don't want to get too deep because it can be overwhelming. But can you just touch on that for us just a little bit, please?
So, as you definitely mentioned, it is such a vast field as far as all of the different types. And you may be able to expound on this a little bit more, but definitely certain types of breast cancers are, as you mentioned, it depends on what kind you have, as far as ones that are receptive to certain hormones. Estrogen sometimes can definitely tend to fuel breast tissue. And so that definitely can contribute to it as well. Kind of overall with the different types, you have like your basically like the carcinoma, what's called carcinoma in situ, which is basically, it's just kind of sitting like right in the ducts. It hasn't really expanded much. And then after that, you have your more invasive kind, which is where it's starting to spread a little bit more, but it's still in the breast only. Like it hasn't necessarily metastasized or spread to other areas of the body. You have something called Paget's disease, which is where it manifests more as like changes to the nipple. So everybody equates breast cancer with, finding a lump in your breast. And it's so much more than that. You can have like changes to the skin. You can have thickening. You can have like flaking or discharge from the nipple. You can have like where your nipple typically would protrude or kind of stick out a little bit, and it becomes inverted in one breast and not both. That's a huge red flag as well.
Mhm.
Absolutely. And you know, getting into the HER2 breast cancer, positive is much more aggressive than negative. I mean, positive, it's you really got to get ahead of it and try to control it, because it's the one cancer that's very aggressive and consuming of women. And so that is why some of the reasons you'll see one woman who may get treatment and she does well, and another one, they keep changing the treatments consistently.
Mhm.
And, you know, I do want to point out that with these treatments, hormone therapies, chemotherapies, for breast cancer, your body can become immune to it or consider it as the status norm. And so then they'll switch your drugs, to kind of give your body a vacation, you know, what we call a medication holiday from that particular drug. They'll put you on another drug because that your body's no longer responding to that chemolytic. So it can give you another one. And the good news for everyone is that technology just keeps expanding with breast cancer medications. We were talking about one today where it's adding like 3 to 5 years to women's life. This is a new one that just came out by AstraZeneca. And I was like so happy. I worked on a breast cancer drug called Verzenio, which was manufactured by Eli Lilly for metastatic breast cancer. And basically, by the time women got to this medication, it was their last stop. It was the last stop before the doctor was like, there's just nothing more we can do. And when you meet these women or men and you get a chance to learn them and know them and you see their lives, it's painful, even for a nurse. It's very, very painful. But the one common thread, and I'm sure Dr. Christensen and you too, Dina, and probably Linda too, can attest to this. The one thing that I noticed in all these women was they still managed to care for everybody else than themselves.
Yeah.
They were more concerned about whether their children were going to be okay, if their husband was going to be okay. And they were the one, you know, with this terminal diagnosis. And that just, it blessed me so, because I was thinking, how unselfish is that? You know, that to me, that's the essence of a woman, our caring nature.
That is so true. And, you know, when we think about it, that means we have to go back to the basics. And I think what Tony said, or, you know, at the top of the show in terms of lifestyle really is, it seems to weave a thread through every single one of the health conditions that we have talked about over the year on this particular program, and breast cancer is no exception. I was reading about, as I go through my own personal weight reduction and getting stronger and healthier and getting prepared, and, you know, for the next stages of my health history, I just thought about all of the issues of inflammation that somehow robs the body of just about its optimal operating systems. And breast cancer, there's an association with it. I was surprised to learn that one of those types of breast cancer is inflammation breast cancer. Never heard of it. But those who are, and it's a growing type of cancer, 1 in 4 from the statistics that have been published, and highly associated with women who are obese. So that goes to lifestyle. That here's yet another reason for us to think about weight reduction and getting into our best health, not for just aesthetic or outward beauty, but because of the optimal health that we can experience if we in fact are not obese. Doesn't mean that you've got all the other issues resolved, but at least you got that one resolved.
Absolutely. The diet plays into that too, Linda. What you eat, and that ties in with this whole COVID thing, getting to inflammation. People were saying, don't have any dairy products, because dairy products, you know, causes the mucus, which can carry the inflammation. And, you know, watch, you know, eating the red meats and increase your cruciferous vegetables, your broccoli, your cabbage, your onions, your garlic. These are, you know, things that fight cancer. And I don't know about you all, but for me, getting rid of my cheeseburger and fries is a little hard sometimes. I'm like, you want to take away what? But I do desire to be healthy. But diet is huge, as you were saying, because those things contribute to obesity, which contribute to the inflammation, which contribute to you know, being more susceptible to diseases. I mean, all this is just interlocked, wouldn't you say?
It seems like it. So we encourage it. Dr. Christensen?
Where was I going to go? I was just thinking the inflammatory type of breast cancer is one of the more invasive. It's not as common, but it's a more invasive form of cancer. And it doesn't always show up as a lump. It shows up, as Deanna was talking about, that's one of those that will show up with skin changes, inflammatory changes, rather than a nodule. And I was also just being reminded that African American women, people of African descent, we need to be more conscious earlier about the precautions that need to be taken to prevent breast cancer or to catch it early.
Well, I see that Anthony has popped in, which means we're probably at the top of the hour already, so fast. And so let's talk about that when we come back from the break. Let's talk about the uniqueness of, what is it called, the triple negative, as it relates to women of color and breast cancer, and what's driving that. Anthony, you left us. Well, does that mean we have more time? Because we can chat all the way.
No, you don't. When you see me, that means take a break. So I just exit.
Okay.
So we'll take a break.
Okay.
Thank you.
Dawn Francis here. I want to invite you to the upcoming new book show. You don't want to miss it. It's going to be amazing and awesome with wonderful authors and wonderful information. It's so exciting. So make sure that you tune in and have a fabulous day on purpose. Why? Because you can. Thank you.
Hello, and welcome to Behind the Inspiration Podcast, the show that encourages and motivates with our 5-minute interviews of inspiration. My name is Ken Waller, and I am your host. The Behind the Inspiration Podcast is a part of my moving forward by helping others identify what true inspiration is. Behind the Inspiration Podcast was developed to provide a platform for sharing awesome, uplifting stories by individuals inspired by events or situational experiences in their lives. You know, inspiration motivates you to be better and to do better. Different things inspire different people. There is so much inspiration in this world. It's important that we start to highlight the things that inspire us versus the things that are destroying us. The Behind the Inspiration Podcast can be heard right here on Anchor Podcast or on the podcast platform of your choice. Thank you in advance for tuning in.
Welcome back to the program, our Wednesday health, wellness, and lifestyle. And this month, we're talking about all things breast cancer to really do as many women across the globe are doing, and that is raising up their pink ribbons and banners and color, wearing it. Our men are wearing it to raise awareness around the dynamic of breast cancer. And so we're so glad and so pleased to have our wonderful guest back, our RN du jour. That's what I like to just say. I just love to say it that way. Deanna Weaver, who has really given us some education, because quite honestly, as before we entered this program, I wasn't clued into the multiple types of breast cancer. So I'm glad that Yvette, you asked that question, because I didn't know about the inflammation of breast cancer. I didn't know about the duct-based breast cancer. And I'm not going to use all of the amazing terminology that we just spoke on, but suffice to say, it's important to have this base of knowledge so that when you examine your breast, you'll knowing that if you're touching your breast and it's warm and you have some challenges, think of inflammation. If you're touching the nipple area or you are touching other parts of the area and you have some indentation, different types versus just a lump, which is what we've all been taught very early to look for a lump in the breast, then it may warrant more examination. So it's important to get into a comprehensive knowledge around all the various types and how you can self-evaluate before you even move into the next level of evaluation. That's mammography and having a very, very important conversation with your breast surgeon or your gynecologist in that regard, and endocrinologist if necessary. So let's continue the conversation.
Absolutely. Before we went to break, Linda, you were talking about triple negative breast cancer. So let's think of breast cancer as a house, and your house has 3 locks on the door, right? So one would be estrogen, the one would be progesterone, and the other one is the human epidural growth hormone. You have none of those with triple negative breast cancer. That's why it's the triple.
Oh,
None of those. You have no locks to open your house.
so you have no locks to open your house.
That's right.
And that is why we have this dynamic, this gene mutation
Right.
that leads to what we now know as triple negative breast
Cancer. So normally with the other breast cancers, one of those 3 locks, you would have a key they could use in hormone therapy, and different treatments. But chemo is the only effective treatment for triple negative breast cancer because of not having the keys for the 3 locks.
That's a great visual, because so take us through the understanding as why do we always hear it associated with Black women versus that we somehow experience triple negative breast cancer in higher numbers, although we actually, our mortality rate from breast cancer is lower than women who are not of color. Is that correct? Because that's what I've learned, that's what I know, that's what I've understood. But this is a program where we do correction of facts.
Right.
If unless things have changed, because a lot of Black women get to treatment later than the white population, our mortality rate has always run higher, even though we might have in the general categories of breast cancer less. We get there late, and our mortality is higher. But in the triple negative, Hispanic and Black women are more commonly found to have that cancer than white or Asian women.
And I suppose, given what Deanna shared with us earlier, which is really vital, is to think about it from that hormonal or that gene mutation. And so is that therefore something more unique to Black women, women of color, Hispanic women? Would that be the reason, or is it lifestyle as an example, and combined with late detection? Are all of those factors that lead us to be more susceptible to triple negative breast cancer?
Definitely environmental. I mean, because we are more prone to different carcinogens in our life because of the way we live. I mean, think about one of the things we do being Latino, Hispanic, or African American, we have a lot of family gatherings. So what do we do in the summer? We
Kind of
barbecue.
dropped off for a while.
Yes.
I think
yes,
I'm gonna-
we do.
Yeah,
we
we
barbecue.
barbecue and the carcinogens that come from that. We smoke a lot of our food. A lot of us smoke, period. Consume high amounts of alcohol, huge amount of soda and carbonated drinks. We live in areas. I was just watching, I don't know if you've ever seen the show that's called What the Health. I was just watching that where there's this whole population of African Americans that live near this pig farm. And it's just horrible because they're breathing in all of the waste. So we don't always live in the best area. So we're getting from factories and car exhaust. You know, if you're in the inner city and cars are going by all the time, we're breathing all of this in, which is, again, more carcinogens, which increase our risk for developing breast cancers. And then you take the estrogen that you don't have, you know, and it's not found in the triple negative breast cancer because a lot of us go through menopause early and we lose our estrogen. And some of that's just simply brought on by stress. You know, African American women, a lot of us are single moms. Let me raise both hands for that. I'm a single mom. And Dina is too, it will stress you to the max when you're trying to work and I'm trying to go to school and I'm trying to run a business and I'm trying to take care of these kids and I'm trying to keep up with my church duties and I'm writing a book and it's like,
And you left out a couple of more things.
Sure, I did.
But yes, we
and
understand.
then I don't sleep because when I lay down, all these things are going through my head that I have to do. And as I was saying about the women earlier, we take care of everybody but ourselves. We're always last on the totem pole. And that also increases our risk for all kinds of health diseases because we just don't simply take care of ourselves.
So you just made a really big association for me because that's been a number one health issue, and that is stress management. I actually had shingles. And so because of that, the hormonal combustions that are happening with my immune system being impacted, therefore has what Deanna said earlier, the inability to adequately fight these different invasions, as I'm going to call them, in my body that would lead to these higher risks for developing cancers. And so I go through meditation I've been doing that for a couple of years, and I've really gotten back into that practice to reset, 20 minutes a few times throughout the day, at least one in the evening and one in the morning time to kind of reset. But that's yet another environmental or actually lifestyle issue that we have to get our hands around. We cannot live in a functional world, our own world, at a super high charge state of stress. There's Donna, and can I just say,
I was just trying to tell Anthony I was in the waiting room. I had to come out and come back in.
but that's okay because presto changeo.
Oh, you didn't notice. I changed that during the break. I remember that I did have a pink something, so I changed during the break.
Gorgeous.
That's
gorgeous.
Yeah, that's great.
So that's really important. So we've talked about the BRCA. We've talked about, and the BRCA test is an easy test, correct? Can you describe that test? Does anyone have some knowledge of it? I don't recall. I think it was a blood test that was provided through my gynecologist, and it came back with a very comprehensive book that was just pretty remarkable, the information received. And so I believe you have a CTP number, and that will give you whether or not you are more susceptible or you in the low risk category.
Mm-hmm.
So it's another number besides your age that you must know. And others, of course. So now we talk about things that I think are really interesting, and that is breast cancer among our younger women. And what are we seeing out there in terms of younger women developing teens, as well as young women in their early 20s and early, even up to early 30s, because we're seeing so many women not only develop breast cancer, but pass away as a result. So we're losing a lot of young people.
Yes, we are. I just was speaking with my niece in Chicago, and it's kind of a unique story because she came from a sister who was my father's child that I didn't know I had, but found me through Ancestry.com. But anyway, she was saying that her niece had just died of breast cancer, and she was only 28.
Wow.
And I thought, oh my God. And I want to kind of expand with what Dr. Christensen was saying and kind of pull her into this conversation about how we often don't find out we have breast cancer until it's stage 4, and why we don't pay attention to the symptoms. And then I want to put this question to all of you guys, and I'm going to be quiet for a minute. Do you think there's a correlation with breast cancer in young women of color? Because they're having sex earlier, they're living their lives earlier, they're doing a lot of things that we just didn't do at their age, smoking and drinking and partying and birth control, the different types of hormones in the birth control. Do you all think that has some type of relationship or an effect as to why we're seeing breast cancer in so many young women?
Well, I have 2 young women. I have a 16-year-old and a 15-year-old who are fully developed. And so it's a very relevant question. And it really is one that I personally, non-clinical in terms of a scientist of medicine, would have to draw a conclusion that absolutely resounding yes. It's remarkable what young teenagers, late teenagers, early 20s, what they're already engaged in. We didn't think about these things because we couldn't buy them. We couldn't buy certain products, couldn't buy alcohol, and you still can't. Couldn't buy cigarettes, and you still can't. But somehow, we have lowered the barrier to getting those items without any punitive issues. It's no longer as taboo as it was when I grew up. It's in the homes. You have younger generations having children. So it's quite fascinating how those lifestyle choices, those early entries, sexual intercourse early in life. Therefore, we all want to make sure that our daughters have protection if that is an opportunity for them. And the introduction of a lot of different food sources, exactly. Is part of it. I mean, listen, I have stock in McDonald's, so I have to go there and just have McDonald's every once in a while. I have to admit, but I have to pull my children and wean them off of that. That is not our summer menu for the whole entire summer. I confessed last time that I had my, former obsession with the French fries, and I'm working on that. I'm glad to hear about your cheeseburger, by the way, Yvette. This is a sidebar. And so, but suffice to say, it's very serious what we allow our children to eat that's contributing to these factors, along with their own personal behaviors and things that they see on social media that register as normal and right.
I'm sorry. Were you finished? I'm sorry.
I am, because when I think about it, I could go on and on and on with teenagers.
I'm sorry. I didn't mean to jump in on you, but one of the things that's kind of under the radar is the hormones that's used to, in chicken, for example, in raising chicken, probably beef as well. And that exposure, we started noticing our children beginning to develop breasts earlier. I mean, I really thought something was wrong with my first daughter when she started to bud breasts at 7, and I mean, I took her to Children's Hospital. I was sure something was wrong, but there's hormones. So making sure to stay away from foods that are grown with hormones, and they're usually labeled now non-hormone raised chicken and so forth, because that's another source.
And it's compounding. It's in our full food distribution stream or supply. So while you think you're succeeding in one area, you have to look at the entire plate of food and snacks that you feed our children. You're absolutely correct.
But the the triple negative is also one that's found in younger women as well. It's just something to keep in mind. But still, we're seeing more of it. That's always been around. So there's something compounding the rise of breast cancer in younger women. It's not just that, but it is seen in younger women.
Thank you for sharing that. I mean, because especially about the hormones in the food, because that's something I don't think about often. And I think we should all think about that when we're, making the choice, the healthy choice, and one is to use more organic foods, and even organic milk is something that I've been buying at home. But now I really have to get rid of this passion I've developed for this Juicy Lucy cheeseburger, because it's just not good, because I had never heard of it till my son's like, you want to try this Juicy Lucy? And I'm like, sure. And I was hooked after that. So pray for me.
I will pray for you, because I cannot imagine, you're a health guru. I cannot imagine you going in for the Juicy Lucy burger. But it brings back something else in terms of self-responsibility. We learned early on, we had pamphlets, we had door knockers, we had lapel pins, we had T-shirts, hats, the rubber band around self-examination, learning to really understand how to examine your body. And therefore, understanding where you may or may not have a lump based on the topography and what's normal and not normal, when it hurts, when there's a tissue and it feels hard versus soft hard. Let's talk a little bit about that. I used to be vigilant every single month on the first of the month. I don't know why I put it there, just gave me a marker. I would do that breast examination in the shower. And I can't recall, probably as of late, because generally during October is when I have my mammogram, so I can be a part of the movement and support other women who also receive their mammograms during this month, is relearning, because our bodies change so much every year that we need to refamiliarize ourselves, if you will, if you're not frequently self-examining your body. Is it just the breast area, or are we examining other parts of the general breast cavity?
So I think it was a really good point how you mentioned about kind of owning the responsibility of kind of being aware of your body. You have to pay attention not only to the breast, but to this area right. I don't know if you guys can see that.
Right
this
here?
area like right in here, that's called the tail of Spence. And that's an area that some tumors can hide out that women may not pay attention to. As well as over like into the armpit. Yep. When you're feeling, you have to feel all of those areas. Yes. So typically the recommendation is number one, to check, like you mentioned, in the shower and just kind of really feel.
Come on, ladies, let's do this. Let's just go right. Let's just do it. Okay.
Yeah, feeling all around, feeling up into this area right in here.
Okay.
And feeling over into the armpit area. And so you want to do that when you're in the shower. And then you also want to do that. You want to lay on the bed, like with a pillow under your shoulder, and do those same motions.
Wow.
And so also looking at your breast, not just feeling, but also looking to see if you're seeing any of those skin changes, dark areas, your breast looking like an orange peel where it's dimpled. Anything coming out of your nipples. If you're not breastfeeding, there shouldn't be anything coming out of your nipples, and definitely not anything like bloody or something like that. And so just really paying attention to those things. And not only that, because you want to be checking monthly, but it's also really important that you're going to see your provider once a year, because there are masses that you may miss, but a skilled provider may pick up on. And so I feel like as women, unless it's time for a pap smear or unless there's something going on, we may not always do that yearly trip to the gynecologist. But it's really important that whether it's your gynecologist or your family practice doctor, whoever, that you have a provider feeling your breast in addition to the mammogram after you turn 40.
And so we have to be very, very supportive of women in their cultures where these types of examination, personal examination, whether sight and feel, so two, sight and feel, and then going to a practitioner and allowing them to also touch that area can be considered somewhat taboo or a challenge. So we encourage all women that it is okay to be healthy and to work through that cultural norm issue or those various challenges that you have, even from perhaps through your religion, to get to the place where you are examining yourself and you're getting the proper examination, both from your healthcare provider, your gynecologist, or your family practice doctor, as well as a mammogram, so that the technology has advanced, ladies. I mean, we have 3D breast examination. I mean, you're going to get smushed. So every woman who's had a mammogram, we know what that,
Yes.
we're getting smushed. But smush me, and I'm just going to stop breathing for that couple of minutes while that X-ray is being
It's not
taken.
even a minute. It's not
It's
even
not a minute. Oh,
It's not even a minute.
it's not even a minute. It's not even a minute, but it's the best time you'll spend on that day for yourself. Wouldn't you agree?
Yeah.
Absolutely.
Absolutely.
Absolutely. Ladies, Linda, can we just for a minute, ladies, can we talk to our sisters out there who have had the mammogram, right?
Yes.
Or have found the lump or got the doctor's report, but they become so paralyzed in fear that they don't do anything. And when they do, it's too late. What can we say to them? Because I have seen that happen so many times, and it's just heart-wrenching for me. They're terrified to even go find out what it is.
Yeah. I've seen it in my practice, and I hope I never have to see that again, because with all of the knowledge and all of the technology now, no one should really die from breast cancer.
Wow. I love that statement. And you're right, Yvette, that is so true. I've had a situation like that as well, because someone did not have high enough literacy to really understand how to prepare for that examination, prepared with lotions, potions, and all kind of aluminum-based products, and then had spots all over the place. And the doctors had her come back in, and it was a very frightening experience, so much so that it took years and years later to actually go and have yet another mammogram. And thank goodness she did not have developed cancer in between that. But it's true. We have to say, if you get a diagnosis or you get a recommendation to go see a breast surgeon specialist or a breast specialist, it is not an inconvenience. There's a reason why your provider is telling you to do so. And I think it would be your best reward and your best self-care way that you can love yourself is to actually follow up on those examinations. You're right, sisters, why don't we want to know the best news, and why do we think getting into the know will give us some bad report? You know, we have to get past that, Yvette. We need to raise that up to a topic of why are we not doing what we're supposed to be doing? It's time for self-responsibility. Self-care is a real thing. So
the survivors have been really good at doing a lot of outreach and education, not only in October, but year round. And I think, that has made a big difference in people being more conscious of everything that might go wrong, or things that might show up that might indicate that you need to have your breast checked. So I really want to thank the survivors for the work that they do. And I was looking at the theme, looking for the theme of this year's, and it says buddying up with one another is important, because no one should go fight breast cancer alone, as one of the themes. But buddying up with one another also to raise awareness, and take your friend to the doctor if you think it's needed.
because I
All
love
right.
what you said, with the technology, no one should have to die from breast cancer if it's preventable.
Absolutely.
Ladies,
Yes.
bravo. Thank you so much. Bravo. That was a fantastic segment. Lots of information, very informative. I want to thank our special guests and contributor, Deanna Weaver, for being a valuable contributor to the program today. And as we continue to observe Breast Cancer Awareness Month, I think we are to, stop and recognize that the lives that we're living, and others that are living their lives, that can understand the grace that you live by, not having to deal with that, and so and be sensitive to others that are going through stuff that you're not going through, and so I'm hoping that this type of discourse will build better awareness and sensitivity, and just people just really caring about it, someone else with that in that position, So unfortunately, guys, we're out of time, and I see that someone from social media just want to share that with you guys. Vanessa says,
Nice.
Absolutely wonderful information. Thank you so much, Vanessa, for that. Really appreciate that. And ladies, until next week, have a safe week, and we will talk soon.
And don't forget to wear your pink. We are still keeping the conversation going.
Yes.
Absolutely. All right. Take care, guys.
Bye-bye.
Bye.